Welcome back. Our focus now will be the A parameter, also known as the discrimination parameter. In the context of IRT, there are three parameters we typically consider. In the last video, we focused on the difficulty parameter B, and we briefly mentioned the pseudo-guessing parameter C. Here, we're going to focus on the discrimination parameter A. It's used in two pivotal IRT models, namely the 2PL and 3PL. The discrimination parameter A is an index of item performance. It tells us about the differential capability of an item. It essentially represents the slope of an item response function graph. The steeper the slope, the stronger the relationship between the ability theta, which as you recall is our latent trait, and a correct response. A high A value indicates the item can effectively differentiate between examinees of different abilities. In practical terms, A typically ranges from 0 to 2, and it serves a crucial purpose. It tells us how well an item can distinguish between individuals who possess different levels of a given trait. But now you might ask, why does this matter for clinical psychology students? Well, in our field, we frequently deal with latent traits, and we rely heavily on test instruments to measure these traits. The A parameter can guide us to develop or select items that best discriminate between varying degrees of these traits. For instance, an item with a high A value in depression can help differentiate between individuals with mild and severe depression. However, just as a tool can be beneficial when used correctly, it can also cause problems if mishandled. Negative A values, although rare, are paradoxical. They suggest that as an examinee's ability or trait level increases, the probability of a correct response decreases, which contradicts our understanding of how tests should function. As future psychologists, you must review such items thoroughly and consider potential revisions to ensure that your psychological assessment retain their integrity and provide reliable and valid results. IRT has some distinct advantages. Unlike CTT, which relies on grouping examinees into high and low scoring categories to determine item discrimination, IRT uses every response from every examinee. This approach provides a richer, more nuanced understanding of item performance and individual differences. In fact, advancements in testing technology have leveraged the strengths of IRT. Advanced software likes to use IRT to develop computerized adaptive tests. In a computerized adaptive test, each test is personalized. The difficulty level of a subsequent item is adapted based on the examinee's previous responses. For us in clinical psychology, this can mean more effective assessments and also reducing testing time and less patient burden, and yet maintaining high test precision. Let's examine the diagram we have, which corresponds to an item on a depression scale we've been discussing. The item has a slope of 1, a location of 0, and an asymptote of 0.2. The location parameter of 0 matches our difficulty parameter B from the previous video. It implies that patients at the average level of depression have a 50% chance of endorsing this item. This suggests that this item is not skewed towards patients with particularly severe or mild depression, but instead lies in the middle of the depression spectrum. The slope of 1 corresponds to our A parameter, the discrimination parameter. In this case, the item has a moderate level of discrimination. It's fairly sensitive and capable of differentiating between patients with different degrees of depression. However, it's not as finely tuned as some other items that have slopes closer to 2, which can more sharply distinguish between varying degrees of depression. The asymptote of 0.2 corresponds to the C parameter, or that guessing parameter. This means that even those patients with the lowest depression scores, who generally wouldn't endorse items indicating severe depression, would have a 20% chance of endorsing this particular item, possibly due to a misunderstanding, a misinterpretation, or simply by chance. This will be the topic of the next video. So in sum, this item on our depression scale has a moderate level of discrimination, is of average difficulty, and has a modest chance of being endorsed purely by chance. Remember, understanding these parameters helps us create more effective clinical assessments. We strive to build tests that provide the most accurate and informative picture of a patient's mental health, and these parameters guide us in doing so. To illustrate, consider an item response graph. The steeper the curve, the higher the A value, and the more the item can discriminate between different ability levels. Conversely, a shallow curve indicates a low A value, showing less discrimination capability. Now, let's put this into practice. If we look at 5 different item response functions, we can see variations in discrimination. The item with the highest discrimination is represented by the red curve due to its steep slope. Conversely, the green curve represents the item with the lowest discrimination due to its shallow slope. So, to answer the questions here, which item has the highest discrimination? It's red with the steepest slope. And for question 2, which item has the lowest discrimination? And that's going to be green with the shallowest slope. Let's take a look at 3 items from a pseudo depression severity scale. Remember, an A value closer to 2 implies a stronger relationship between the latent trait and a correct response, meaning that the item is highly discriminative. And conversely, an A value closer to 0 implies that the item is less discriminative. Here, item A with a discrimination parameter of 0.5 might ask, do you often feel tired? Many individuals, whether depressed or not, might respond yes, making this item less discriminative. Item B with A equals 1 could be, do you feel hopeless nearly every day? This item is more likely to differentiate between depressed and non-depressed individuals, as feelings of hopelessness are more characteristic of someone with depression. Item C with A equals 2 could ask, do you frequently think about death or suicide? This item strongly discriminates between depressed and non-depressed individuals, as this symptom is usually present in severe depression. Now, let's imagine we have a scale assessing deceitfulness. Here, item A, being 0.5, could be, have you ever told a white lie? As this is common behavior, this item won't strongly differentiate between highly deceitful individuals and others. Item B, where A equals 1, might ask, do you often exaggerate or embellish stories? This item could differentiate more clearly, as habitual exaggeration may indicate a tendency toward deceit. Item C, where A equals 2, could be, have you ever fabricated a significant event or lie to manipulate others? Here is a strongly discriminative item because this behavior is much more likely in highly deceitful individuals. Lastly, let's consider items from a test measuring executive function. Item A equaling 0.5. Can you remember a short grocery list? This task is relatively simple and does not strongly discriminate between different levels of executive function. Item B, where A equals 1, can you plan and prepare a meal? This task requires more executive function, differentiating those with average and lower executive function. And then we have item C, which A equals 2 here, and it states, can you manage your finances, plan for future expenses, and keep track of bills? This complex task strongly discriminates those with high executive function from those with lower abilities. I hope these examples provide a clearer picture of how the discrimination parameter A functions across various psychological domains.